stand up and give presentation. Good.
Dr. D is a doctor here in our hospital. One day, Dr. D do surgery for patient, and in a procedure, Dr. D inadvertently cut off other chapter.
Okay, wait up. I'll ask you a few questions to make it clear. Yeah. So there is a doctor, Dr. D. He is a professional surgeon. Yeah, and then he did his surgery to a patient, and then suddenly, in coincidental moment, he cut his finger off. My first question, actually, did he do the good SOP on the patient or not? While he was doing her surgery, actually, everybody can have accident. Everybody can have ungrateful moment. But actually, instead of the finger cut action, do you think had he done the good SOP to his surgery? Did he do something right on the surgery or not? Instead of the finger cut. What is the reason?
Because good
Preparation.
preparation
He should not cut his finger off. Okay, fine. I will accept that. And then next.
and then after the doctor cut off the finger, the record there is not any exposed the blood. And after the incident, Dr. D checked the blood in the laboratory, and the result is Dr. D have a positive HIV.
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 Yes. And then
Then Dr. D is resigned from the job surgery in hospital, and the problem is so the hospital disclose Dr. D disease.
thank you. A. Okay, sit down. A. I haven't given you the solutions, yeah, but name? Yeah. Give him the yes, the paper. A. Because I will give you 5 questions, 1A after this. 1 presentation equals A, 5 questions answered equals. So it's your choice. A, yeah? Okay, there is a doctor. This doctor is professional actually, because he has succeeded in operating 279 patients successfully. However, in this one case, accidentally he cut his finger off. Someone or he or his assistant cut his finger off. There is no proof his blood is contact thing with the patient. There is no proof. However, there is a protocol that after you have accident, you have to check yourself out. Yeah? And then the result, the doctor unfortunately exposed HIV positive. That's what she said. And then the problem, should the hospital disclose Dr. D's disease to public? Or should the hospital give this as a confidential case? Should the hospital off the record about this case? Next question is also for you who haven't got 4A's. If you can give me the answers, the argument of yes or the argument of no, I will give you Should the hospital disclose Dr. D's disease? If you say yes, what is the argument? And also you have to give me no. And what is that? There is 2 yeses and 2 no's in this article. Nobody? Nobody? You? No, you try to not to read. If you fail, then you can repeat, but try to have eyes on that. Oh, sorry. 3 no's and 2 yeses. I will count until 5. If nobody stand up. No for expert. Okay, you just explain me 1 yes and 1 no. 1 yes, 1 no. That is A. Oh, you already wait. But if you can explain me 3 yeses, yes, 2 yeses and 3 no's, I will give you. On the other guy, because this is a opportunity. Yes? Yes? Or no? Yes. Stand up.
I cannot agree with this.
No, it's not you disagree. Yes, after this I will talk about opinion. But before that, explain me the reason of yes and the reason of no. The reason of yes, why the hospital should disclose the case, and the reason of no, why the hospital must open the case to the public. Yes, 2 explanations. Okay, not yet. Oh yeah, not yet, not yet. You are the Q&A. Yeah. Q&A club, yeah. How many A's you have? Okay. 1 yes, 1 no.
Yes.
Stand up.
It is because the patient must give up their service from the hospital, and hospital is a responsibility to patient exposed HIV. And if no, because the doctor have a privacy, and the hospital not right to expose them.
2 A's. Should the hospital disclose Dr. D's disease? Yes. Why? You say, because the hospital has responsibility in the patient's safety. It means all the risks, all the things, all the treatment, and the implications to the patient must be informed to the patient, because the patient has the right to understand his disease, his treatment, and the implications caused by the treatment. That's the patient's right. No, why? Because doctor has the right of privacy. The doctor has the right to protect his safety also and his family. That's the beauty. Yeah? Another reason instead of these 2 reasons. Okay. I will count until 5. 5. Yes. How many A's you have?
3.
Yes, please.
I think the hospital should disclose the properties because it involves the health of other people that contact with the properties.
Okay. What is the reason of? Let's discuss. Yeah. What is the reason of close? One reason.
Because the properties has privacy right.
Already said by her. The other reason. There is internal cause and external cause. If the hospital discloses the case, yeah. And there is internal cause and external cause if the hospital closes the case.
The hospital was discussed. The hospital will have
Okay, repeat. Your answer, your first answer. Repeat, please.
just because it's involved health of other people, so the case should disclose.
Okay, disclose the case because it has risk. Yeah, if we disclose the case, if we close the case, the others say other people's health will be threatened. There is a virus. Perhaps this virus is contaminating the patients, 279 patients, and it's moral duty for humans, moral obligation to tell them the risk. That's why the hospital should disclose the case. Then why, and on the other hand, why the hospital should consider to close the case? Disclose because it is related with people's health. What about to close the case? Two considerations. Because you can choose internal or external cause.
Discuss because we'll have the for the hospital.
Yes, correct. A. Why? Okay, now we understand the context. There is a difficult case in here. This is a good hospital, a professional hospital. The doctors who work in this hospital are professional doctors, and perhaps they are very respected doctors. Yeah? That's why the